What is the definition of relapsed myeloma?
So when we're talking about multiple myeloma that a patient has had for however long, and they were treated originally for it and responded and it went back away. When it first comes back, that's relapse disease. So basically where you get to a point where there's less than where you started and it starts growing again. That's generally relapsed.
Relapsed myeloma suggests that the disease is out of control. It's either getting worse off or on therapy.
The patient is considered relapse if the disease evolves, comes back after that regimen or that drug has been discontinued for more than 60 days.
So first, talking about relapsed and refractory myeloma, it's always important to consider the differences in the definitions of the two processes at hand. So relapsed myeloma, we think about in patients that have had prior therapy, and then the patient develops a relapse subsequently thereafter. That doesn't necessarily mean that they are on any continuous therapy per se, although most of our current protocols do allow for continuous treatment. So relapsed myeloma by definition is any disease that has progressed after initial line of therapy.
What is the definition of refractory myeloma?
In contrast to refractory myeloma, at that point, we start to think about what the patient has been previously exposed to and whether they're relapsing on a particular agent or not. So we define refractory myeloma as refractory to a different class of medications that we currently have available, such as proteasome inhibitors, immunomodulatory drugs, and increasingly monoclonal antibodies. And that definition is really centered around whether they've been exposed to those agents and also whether they've received them usually within the last 6 months or so, sticking with the refractory definition. So when thinking about relapsed and refractory, it's important to think about those differences mainly as it relates to what therapy have they received prior to the most recent relapse that we see.
When you're talking about refractory disease, you're talking about a kind of myeloma that is either not responding to treatment, meaning that you just had your first relapse, you started on new treatment, and your M spike doesn't budge. That's refractory. Or technically is that it grows again within the first 60 days of starting treatment.
To make it very simple, the patient's disease is considered refractory to a given drug if the myeloma progresses while the patient is on that drug or within 60 days of discontinuing the drug. A very typical scenario, patients receive therapy with RVD, let's say for a year, and after the 1 year the patient continues on lenalidomide, on Revlimid, and at some point the myeloma progresses. I mean, the M spike goes up by more than half a gram. Well, at that point, the patient is considered refractory to Revlimid, but is relapsing after Velcade. So the patient is not considered refractory to Velcade because Velcade was discontinued more than 60 days ago. Those definitions are somewhat arbitrary, but it gives us some guidance when it comes to managing patients, and particularly when it comes to interpreting data from clinical trials. Evidently, a patient who is refractory to many drugs is a more challenging patient, and you expect inferior results whenever the next agent is being employed.
Refractory disease, from usually a clinical trial standpoint and the way myeloma physicians describe it, is myeloma that is not been responsive to therapy or started progressing within 60 days of stopping therapy. So oftentimes clinical trial eligibility says that patient has to have relapse disease and it has to be refractory to the last line of therapy, meaning they progressed or the disease became out of control while on treatment or within 60 days of stopping treatment. That way, it's trying to insert some sort of homogeneity into the type of patients described in a clinical trial so that we're not describing some patients who have lingered on without any treatment for years versus those patients who've gone from treatment to treatment to treatment, one right after the other.